Different sex drives? We have tips, plus how to maintain a strong relationship when you're going through IVF. Everything you wanted to ask about sex, but didn't. Now you can ask Dr. Leah, sexual health expert and associate professor in the Department of Health and Human Performance. Here she is, a very lovely Dr. Leah.
Thanks, Derek. It's great to be here today with all of you. I'm Dr. Leah Janine. We're here to answer your questions about sex and relationships. We have a lot of the latest research and a little common sense. Plus, we have a special guest here to share the truth behind the common ED treatments. But first, let's take on some viewer questions.
Dr. Leah, we got a lot of great questions today. A man says, I last too long, usually about an hour, and it wears out my wife. What can I do to make it quicker?
You might want to try doing some Kegel exercises to strengthen your pelvic core muscles. It may help you gain more control over when you climax. A basic exercise is where you contract and relax your muscles in your pelvic region. You want to hold that for 5 to 10 seconds and then release for about 5 seconds. You can also work up to 10 sets, and you should try to do these maybe up to 4 times a day. You could also try cutting back on masturbation. While for some men, they find that doing it before sex can help prevent them from climaxing too quickly, others find that masturbating earlier in the day can decrease their libido and increase the time it takes to climax.
Yeah, you've mentioned in other episodes Kegel exercises and masturbation, so obviously that's a fail-safe way. But what else could they do?
Well, there are other options that you can try. Clearing your mind and focusing on the moment. If you usually only have sex in one position, try something different that may offer a new sensation. Ask your wife to stimulate other areas of your body. It's full of erogenous zones that can not only give you more pleasure, but can also excite you faster. Or how about a little role playing or adding in some sex toys? Doing something completely different will help shake things up and could help you climax earlier.
Great advice, Dr. Leah. Our next question, a woman wants to know, does going through IVF affect sex? What is IVF?
Well, in vitro fertilization can affect your sex drive. Studies have shown that women going through IVF can suffer from a low libido because so much is depending on timing with the procedure, from egg stimulation to embryo transfer. It may seem just like a very mechanical process where sex becomes regimented. In fact, it becomes so regimented, the reports actually indicate that this is one of the times that men are most likely to cheat. The treatment also causes large hormonal changes in a woman's body, and the medication can result in vaginal dryness, which can make sex uncomfortable. Plus, the stress of going through the process can take a toll on your relationship.
Is there anything else they could do, like if they are choosing IVF?
Yeah, there are things that you could do to overcome low libido. Focus on the other benefits of sex instead of just thinking about getting pregnant. Think about it as a time to reconnect with your partner. If you don't feel in the mood, just try holding hands, share a kiss, or snuggle together. Even if this doesn't lead to having sex, it's quality time spent together.
Yeah, sometimes a little snuggle leads to something bigger in the long run, so keep it up.
Absolutely.
Dr. Leah, viewer says, how do you learn about new sex positions without watching porn? I'm looking forward to your answer on this one.
There's a lot of ways. One good place to start is on your smartphone or tablet. There are apps available that have illustrations and descriptions. Many of these apps are based on the Kama Sutra, an ancient Indian text on sexuality. There is one that's 101 positions of the Kama Sutra, which is an app where both parties spin a wheel and the illustration will show a position based on where each person's wheel stops. There's also the Big Book of Kama Sutra app, which holds all the positions and has hand-drawn illustrations. While the app is free, you do need to pay extra for all the positions in there.
Man, 101 positions, that's, wow, okay.
See?
What other apps are out there, Dr. Leah?
Well, there is another one that allows you to email a position to someone. Yeah, hey, why not? There are also game apps where you can play a game with your partner, like Connect, Foreplay, or the Kama Sutra's Complete Guide, Sex Guide, an adult sexual game. All these are like sexy games to play with your partner. And if you don't feel comfortable using an app, you could just buy the Kama Sutra in the old school like book form. I actually have an authentic one that I purchased while I was in India.
Still to come on Sex Talk. Antidepressants and sex. New ED therapies. Preventing HPV.
Enjoying an intimate relationship while on antidepressants can be challenging. Here's a little more information, plus some tips for managing the side effects of medications.
While antidepressant medications work wonders in managing depression and other mood disorders, they often come with a catch: sexual side effects. It's not uncommon for people on antidepressants, especially the popular ones known as SSRIs, to experience a drop in libido, difficulties with arousal, or trouble reaching orgasm. It can be frustrating and even distressing, but the good news is you're not alone and there are options. The key is open communication with your healthcare provider. They can help you find a medication that might have fewer sexual side effects, adjust your current dosage, or even suggest strategies to counteract these issues. Don't let concerns about your sex life keep you from seeking help for your mental health.
Having an open conversation with your doctor always helps. They may switch your medication or find other ways to lessen your symptoms. Coming up, how to deal with different sex drives. Plus, a men's health specialist is here to tell us how well new ED therapies work. That's next.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to askdrleah.com.
Welcome back to Sex Talk. Today we have Director of Reproductive Urology at the University of Miami, Dr. Ranjith Ramasamy. Thank you so much for joining us.
Thanks for having me, and I look forward to speaking to you about topics concerning sex.
Great. So today we're talking about restorative therapies for ED, like shockwave therapy or PRP. So let's just jump right in. Tell me about how effective these treatments are.
So right now, we're doing clinical trials using both shockwave therapy and PRP and platelet-rich plasma for men with erectile dysfunction. So far, that we've shown that it's actually pretty safe. That if you do shockwave therapy, which is high-energy ultrasound to the penis for erectile dysfunction, or PRP, which is platelet-rich plasma for erectile dysfunction, it appears to be safe. But we've actually shown that PRP alone, when used by itself, actually does not seem to improve erectile function any more than placebo. But at the University of Miami, we're actually doing a combination clinical trial. We're doing PRP, we're injecting PRP, and we're providing high-energy ultrasound with shockwave therapy right after that. And we're still waiting the data to be finalized, but we think when used in combination, that effect will be additive in trying to improve blood supply and more vascular tissue for the penis for erectile dysfunction.
And just to clarify, the type of ED that we're talking about is just men that are having difficulty getting an erection or maintaining an erection, not, orgasmia. So what types, I guess, would these therapies cover?
That's correct. So these are men who have erectile dysfunction who are either unable to get an erection or maintain an erection. But we've also seen that these therapies seem to be effective in men who have mild to moderate erectile dysfunction. Doc, I haven't even started taking a Viagra or a Cialis. I do not want to take pills for erectile dysfunction. I want to try to see if I can do something natural. These therapies seem to work in those situations. I'm able to get an erection. I'm unable to keep it and maintain it for a long time. And I used to be able to maintain it for a long time before. Those men would probably benefit from these therapies. I can never get an erection. I had a prostate surgery last year. I had radiation to my prostate last year. I have severe diabetes. I'm actually not even able to start an erection. I think these therapies will likely not work in that patient population.
Okay, so what would a patient expect from either PRP or shockwave therapy? Just walk us through what a sample session would be like and how long it would last.
Sure. A shockwave therapy session lasts about 10 to 15 minutes. A penis is basically applied on stretch. It's put on a device, which is high-energy ultrasound, and you feel like somebody is basically tapping your penis for about 10 to 15 minutes. So there's not much pain associated with it. We really don't take any pain medications. Patients usually read their iPhone or some article and are able to leave. PRP is a little bit more involved, where you're actually drawing blood, spinning it in a centrifuge and injecting it. So it does involve the needle injecting enriched growth factors into the penis. But at the time of injections, patients experience very mild pain, but really it lasts for about a few minutes and goes away. So not very onerous, not very painful, but really we need to understand whether it works or not, and more importantly, who it works in.
Okay, so before we go, what is a final thought that our viewers should know about either of these two therapies?
So I think men and couples, female partners are also interested in their male partners having good erections. I think that it's equally important and applies to everybody. I think they should research about whether the therapies that they're getting are actually legit, if it's being done at an approved facility, what machines are being used for shockwave therapy, what PRP is being used, and verify the doctorate that they're getting it from, and make sure that they're not spending a lot of money with absolutely no efficacy. If they have opportunities to participate in clinical trials that we're doing, like here at the University of Miami, absolutely call them and see if they would be eligible for those things. So I think really the important thing to understand is, because these therapies are still experimental, there is a role for them. We just need to make sure that people don't get cheated by not getting the proper treatment.
Well, thank you so much. Great advice. And we'll be right back with more Sex Talk.
Still ahead on Sex Talk. Day after discharge. Preventing HPV. Can you strengthen the stream? When partners have opposite sex drives.
Back here on Sex Talk, let's take some more questions from our viewers.
Excellent. A woman says, I always have a lot of discharge the day after sex. Is there any way to lighten the load?
On average, a woman produces between 1 and 3 milliliters of vaginal discharge daily. However, it's important to note that even though this is average, every woman is different. Since your body is unique, getting to know your body and what's considered normal for you is important. There could be several reasons for your discharge, including an infection. A bacterial infection's discharge is going to be off-white or gray and would have an odor, or yeast infection's discharge is going to be clumpy.
Could it be natural?
Yes, another reason that you may have discharge after sex depends on where you are in your menstrual cycle. Your cervical mucus actually changes throughout the month to accommodate your changes in hormones. Beginning and end of the menstrual cycle, you may notice your discharge to be thick in texture and white. During ovulation, you may see your discharge to be clear and sticky. Towards the end of your menstrual cycle, your vaginal discharge may be brown. This brown color may be alarming, but it's usually just old blood that's present from your period.
All right, here we go, our next question. A viewer asks, is it possible to get rid of a gag reflex?
A person may gag for really 2 reasons. Physical and psychological. These are sensitive places near your mouth's back, like the tongue's base, which can lead to gagging when stimulated. In some cases, the gag reflex can also trigger the cerebral cortex that contains sensory and motor areas. This means that even if you think about something that gives you a gag reflex, you'll experience one. For many individuals, the reason for gagging can be purely psychological. To control this, you need to undergo mental treatments to manage other external factors that may impact your psychological state or behavior. You can try relaxation techniques or divert your attention to something else. Some people even go through cognitive behavioral therapy. There are also oral medications and topical ointments which can help reduce the severity of the gag reflex. Sedatives can slow and relax the mouth and the throat muscles that decrease the chances of gag reaction.
Yeah, I would think also that the gag reaction is kind of almost like the body's protecting itself, so it's maybe choking on something. Is that?
A lot of times it is, and especially when it's physical. When it's psychological, usually not. It's kind of like if you see somebody else throw up, then you want to throw up. It's not really protecting you from anything at that point. You know, that's just going to be your psychological reaction.
And what about this thing called tapping?
Well, there's another way to alleviate or get rid of the gag reflex. It's called a temporal tap. So temporal tapping begins in a circular motion in front of the ear, and then slowly the movement reaches the ear's back. Many patients have found this technique to be highly effective, and it's also really easy to do. The tapping creates vibrations that stimulate the vestibular system, and temporal tapping reverses the function of the vestibular system, then reduces gagging.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to AskDrLeah.com.
Did you know that as many as half of sexually active people have been infected with the human papillomavirus, or HPV? Here's what you need to know and the steps you can take to protect yourself.
The best defense against human papillomavirus, or HPV, is getting vaccinated. The HPV vaccine is typically recommended for both young boys and girls, starting as early as age 9 up to age 26. Condoms can also help lower your risk of getting HPV, though they're not foolproof because the virus can lurk in areas not covered by a condom. Regular checkups and cervical cancer screenings for women, known as pap smears, are vital too. They can catch any abnormal cell changes early before they turn into cancer. HPV is the most common STI worldwide and is linked to several cancers. Staying informed and taking these steps can help you keep HPV at bay and reduce your risk of related health problems down the road.
It's so important for women to get the routine pap smear. Early detection can make it easier to treat. Now let's take on some more questions.
That's right, girls. Get your pap smears. Don't be like hard-headed like men with a prostate examination. Get your pap smears, right, Dr. Leah?
Absolutely.
Thank you. Our next question, Dr. Leah. A viewer says, how can I make myself taste better for my partner? He has no complaints, but I want to do what I can.
Well, a good rule of thumb is any food that modifies the smell of your sweat or your pee will also modify secretions from your vagina, which will impact the taste. Try to avoid smoking and cut back on the booze or cigarettes if you smoke. If you ever hit the gym a night after drinking or smoking, you might notice that alcohol and tobacco can really change the scent of your sweat, while the same goes for the scent of your vulva. Both can make you smell more sour or bitter or more stale than usual. You also want to make sure that you remain hydrated. When you don't hydrate, everything becomes concentrated. This is why your urine smells more strongly when you're dehydrated, and that's the same for vaginal fluids. A change in flavor or scent often indicates an infection, especially if these are accompanying symptoms like a change in discharge or itchiness. So contact a healthcare professional to find out what's up. There's also some evidence that boric acid suppositories can help treat some recurrent vaginal infections. This means that it might help remove an unpleasant taste related to those conditions. But you definitely want to ask your doctor before trying it out. Remember also, boric acid is not for oral consumption, so you don't want to insert it right before you're...
Oh, yeah, that's a good point. How about flavored lubes? Would that maybe help, applying some of that and just to make sure that she feels better?
Yeah, I mean, and that's obviously going to affect the scent. Those flavored lubricants also smell like what they're supposed to taste like, you know, so that can kind of help mask it. But
Right.
if there's an infection, just better to treat it and not have any issues.
Okay, well, and how about for men? Anything for men?
Well, the same goes. Avoid that asparagus. I know there's the big myth of like pineapple juice is so great. Yes, pineapple juice is a little sweeter, fine. But the really big ones, avoiding asparagus, tobacco, cigarettes, anything along those lines are going to really negatively affect you.
So basically, there's no miracle fruit like, you know, the mango or what do you call it, passion fruit or something like that?
There is actually something called the miracle fruit. It's something along those lines. It's not meant for this reason, although I have heard that it does help. So it's a fruit that you kind of chew for like 20 seconds, and it's supposed to make everything else taste very sweet that you consume, right? I have read a lot of reports that it works for people. I will tell you, I actually bought it online and then bought a bunch of celery. I'm like, ooh, this is gonna taste wonderful. And I didn't notice a difference at all. Like my celery still tasted like celery. But I have heard other instances of people like taking it and then drinking apple cider vinegar, and they said it tastes like apple juice. So the one time I tried it, I didn't notice a difference, but I have heard other people say that it works.
Do you remember the name of this fruit by any chance?
It is called the miracle fruit.
It's called the miracle fruit.
It is called the miracle fruit. Okay. Yeah, it's like, and they come in like little individual plastic things. It's not like a fruit on a tree. So it's kind of one of those you can get on Amazon. I've never seen it in Publix or anything along those lines.
Okay. I haven't seen them like in 7-Elevens
No.
or gas stations. Okay.
No, I bought it online.
Okay, good. Our next question, Dr. Leah. A man says, how can I make the stream stronger when I ejaculate?
Well, like the size of a man's penis, the strength of your stream, or the amount of semen you have to ejaculate really has nothing to do with pleasure, fertility, or sexual performance. The stream is a combination of sperm and seminal fluid. The fluid helps the sperm reach their destination and also provides the volume of your stream. You may have noticed that you ejaculate a larger volume of semen if you haven't had sex or masturbated in a while. So you should avoid masturbating if you're planning to have sex that day or evening.
So what else can our viewer do for this?
You could also try pelvic exercises. Your muscles in this area play a major role in the velocity of your semen and can offer extra benefits. For example, it lessens the risk of premature ejaculation. If you smoke, stop. In some cases, it can cause erectile dysfunction. And there are studies that show that it can reduce the average amount of sperm.
You know, they always say, you know, check with a doctor, this and that. Always consult your doctor. Can a doctor help in this case?
Yeah, your doctor can help you and direct you towards ED medications like Viagra and Cialis. There are a number of studies that show that the FDA-approved ED medications can also work for some ejaculation problems.
Our last question of the day, Dr. Leah. A viewer says, my partner's sex drive is the opposite of mine. Is this something we can fix, or is it worth breaking up? I mean, breaking up, that's pretty drastic. I'm sure you can fix it, right? Surely they can fix it, correct?
Yeah, with different work schedules, family responsibilities, and other stressors in our lives, it's not surprising that our partner's sex drive just may not be in sync with ours. But there is hope, and it can be fixable.
Okay, let's hear some hope. What can they do?
How about trying a date night with your partner? Try returning to things and places that you both found enjoyable at the beginning of your relationship. Be open and honest with your partner about your desires and your needs, and make sure to listen to theirs. Schedule time for sexual intimacy and don't always have sex at bedtime. Set the tone with a phone call or text earlier in the day so that you're both in the mood when you get together.
You know, that's a good point about going back to when you first dated. So maybe, you know, because there's always like, man, everything's wow. Not, you know, you're nervous, you're picking her up or him up or whatever. And it's always like, it seems to be more intense. So I like that advice. Would you recommend seeing a doctor or a therapist if this challenge is in your relationship?
Well, it really depends on if the condition is physical. So the man might just have an issue with erectile dysfunction and feel too embarrassed to initiate it, or maybe the woman's having recurrent yeast infections. So if the problem is physical, then you definitely want to see a doctor. You also want to think about how it feels when you're initiating, and like, are you okay with initiating all of the time? Are you okay with being occasionally rejected? Are you getting rejected, right? So if you've got mismatched sex drives and one person's always initiating, but they don't mind always initiating, and the other person then receives, I don't really see it as a big deal. But if one person is consistently initiating and then they're consistently getting rejected, that's not going to feel great. So you have to think, you know, how do you feel about your partner occasionally saying no to you, right? And if the difference is someone wants to have sex 2 times a week and someone wants to have sex 5 times a week, I don't think you need to go to therapy in there. You need to just kind of work it out. But if someone wants to have sex every day and the other person wants to have sex once a month, then you might need to seek counseling to kind of find a medium that will work for both of you.
Okay, so, you know, sex, even if their sex drives are different, I mean, there's other things they can do. Correct?
Yeah, remember, sex isn't just a physical act. It's a great way to connect emotionally. So just enjoy cuddling and some quiet time together. Just try to put aside your busy day to enjoy each other's company. Well, Derek, that's all the time we have for today, but you can still send in your questions. I'm Dr. Leah Janine, and we will see you next time when we answer the questions you've always wanted to ask on Sex Talk.